Doctor caught having sex with nurse after leaving patient in middle of operation. The patient was under anesthetic, so the doctor took the opportunity. The doctor is facing a tribunal after he took a break from a patient's operation to go and have sex with a nurse, with the pair of them being caught in a compromising position by a colleague. And as of today, which is Tuesday, there has been an update on his tribunal, which I will address at the end of this episode. Consultant anesthesiologist, if that's how you want to pronounce it, Dr. Suhail Anjum, and an unnamed nurse referred to as Nurse C, had been working at Tameside Hospital, where they were caught by a colleague who walked into the operating theatre where they were having sex in. A medical tribunal heard that a patient had been placed under anaesthetic for the operation when Dr. Anjum asked a nurse to monitor his condition while he left the room for a comfort break. Is that what we're calling it these days? Instead, he went to a different operating theatre and was caught by another nurse who told the tribunal they encountered Dr. Anjum and Nurse C in a compromising position. Oh my. You just can't get the right staff these days. Regardless of what it is, you just can't get the right staff. The nurse who found them, referred to as Nurse NT, found the woman with her trousers around her knee area, with her underwear on display, while the doctor was in the process of tying up the cord of his trousers. Nurse NT quickly left the room after what she had seen, I don't blame her, while Dr. Anjum, who is 44, returned to the operating theatre and had been gone for around 8 minutes. A personal best record, 8 minutes. The tribunal said it is right to say that no harm came to the patient when Dr. Anjum was absent from the theatre and the procedure went on without further incident. They heard that on 16th of September 2023, the doctor had been the enthusiast for 5 cases in Operating Theatre 5 and had left the room during the 3rd case. I would have vouched for a comfort break as well. The doctor said he didn't dispute any of the facts of the case and admitted he engaged in sexual activity with Nurse C, saying he knew when he left the patient during the operation she was likely to be nearby. He admitted he had put his patient at risk, but claimed it had been a stressful time for his family as he and his wife, who is not Nurse C, were struggling to connect as a couple following the premature birth of their daughter. Well, here's a simple solution. Have time off work. Take time for personal reasons to help with your, connection with your wife. Whatever it is that's going on between you two. Take time to have couples therapy or whatever it may be. That seems like the more reasonable approach. I get some people are workaholics, so they would prefer not to take time off work, but that would be the most reasonable idea, in my opinion. Dr. Anjum left Tameside Hospital in February 2024 and returned to his native Pakistan, but he told the medical tribunal he wanted to come back to the UK to work as a doctor and promised he would never repeat his one-off error of judgment. He said, "It was quite shameful to say the least. I only have myself to blame. I let down everybody, not just my patient and myself, but the trust in how it would look. I let down my colleagues who gave me a lot of respect." So now here is the update that I told you about earlier, where the tribunal has now made a decision regarding Dr. Suhail Anjum. The tribunal came to a decision about Dr. Anjum's fate on Monday the 15th of September, ruling that the dad would not be sanctioned for the incident, that the 44-year-old had put his own interest before those of the patient and his colleagues, while saying that Nurse C had the potential to distract him. Really? Really? We're blaming the nurse? Come on now. He may not have been able to give his full attention to the patient's care, the tribunal said. Oh my god. Rebecca Miller said that although the patient did not come to any harm when Dr. Anjum left, the consultant anesthesiast's actions were significant enough to amount to misconduct that was serious. Despite this, she said she was satisfied that he would not repeat his behaviour, saying that the risk of him doing so was very low. Are you actually serious right now? Like, what the fuck? Like, sorry, I'm not asking for the guy to be fired or anything, but like, the chances of him potentially repeating this are very low. Are you sure about that? Are you 100% sure? Really? Why? Because he gave you his word? But I digress. The tribunal considered that members of the public and the profession would understand the high level of scrutiny to which Dr. Anjum had been subjected to, and that a finding of serious misconduct would weigh heavily upon him, Ms. Miller said. The tribunal was satisfied that his public finding of serious misconduct was significant to retain public confidence in the profession and proper professional standards, and that there was not a necessity to make a finding of impaired fitness to practice for that purpose. Dr. Anjum has escaped without any sanctions being imposed. However, the hearing in Manchester will now reconvene tomorrow, which is today, the 16th of September, to decide whether a warning will be issued on his registration. So with that being said, please let me know your feelings down below. Whether or not you think further action should have been taken against this doctor, or whether or not you believe that he will in fact learn this lesson from his... I don't want to see anybody lose a job, ever. But at the same time, if you're going to be a dickhead and, risk your patient's life by leaving the patient mid-operation to go have a quick shag, then I think you're an idiot. I think you're in the wrong kind of profession, if I'm being truly honest. Like, maybe this isn't for you. Maybe you should go somewhere else and, do whatever it is you want to do there. All due respect to him and his family. I know he said he had issues going on with his family. That's, unfortunate to hear. But at the same time, that's not an excuse to go and have sex with a nurse while you're in a mid-operation procedure. That just doesn't fly. That shouldn't be an excuse whatsoever. But, as always, I'd love to hear you guys' feedback. So drop your comments down below. And until next time, take care, stay safe, and I'll see you guys next time. Bye bye for now.